we'll get started. Why don't you just shut the door? That'd be great. We'll get started. Well, today's topic is a little bit unusual in title, but bear with me, and I think you'll understand where I'm coming from, with this. The heart obviously is very anatomy and physiology. That's one of the reasons I became a cardiologist. Is something you can listen to. You can image. You can help people if you find a blockage and improve that flow. So that anatomy, physiology, and the things that we can do is what cardiologists do well. But there also is this other side that do we do well. The heart in literature has emotion. It remembers. Aristotle thought it even was the source of all our nerves. So it thinks. It talks to us. It loves, hates. It hopes. I mean, there's a lot that goes on that we say is because of the heart. And is it? I mean, the brain thinks, brain remembers. But it almost has functions like the brain. That we've given it in literature, and basically it's defining, our how and why we live. Clearly without the heart we don't live, and it's the how, but the why and the purpose and a lot of different things. My background, my Christian background, that people know me, is that we were created and we have a designer and we are designed. I mean, when you really look at that design, it gets down to the DNA and it's code. I mean, it is amazing. DNA and all of its discoveries and processes and things. We are in this brand new world of DNA right now and understanding it more. Making medications based on it, correcting things, defining even risk for certain people that were not able to be defined. But what's interesting is it's not all that we can see or measure that really influences our heart. Our environment, what we're around, we've talked about stress, and we'll talk about that more. But all of those things do have its effect, and it affects our DNA. This is an interesting book by Dr. Paul Brand. He was a missionary, physician that dealt with leprosy of all things. But he wrote this book called Fearfully and Wonderfully Made. And it's an interesting book to read. This thing never stays in perfect focus. But I've talked about it that my goal is to educate people about health and ways of improving their choices. And we talked about this green line of health, that if people at least stay on this health line, that they're taking care of that future self. That's like the Fidelity green line, have retirement money at the end if you take care of it now. So we need to, our decisions that we make each day are for good or for bad. I mean, and clearly we don't always make good choices. We should be making choices toward health. We often don't. We make choices toward disease. And each of these affect, our outcomes, our overall outcomes. For me, getting back to the root cause is very important. And so when I look at a process of disease or something going on, I'm trying to get back to that root cause. Well, unfortunately, a lot of what's coming at us is poor lifestyle choices. About 80% of what I take care of is actually preventable and sometimes reversible with lifestyle changes. But they're very difficult to make, and obesity is clearly not always an easy just choice to make, because it is a disease. Years ago, people thought it was just a behavioral problem, and if you just tell yourself to do this, you could do that. Well, unfortunately, the cycle of obesity is tougher. And once someone gets into an insulin resistance situation, that is the enemy, and it is this cycle of problems that happen that create what's called the metabolic syndrome. That really is not totally just a choice thing, and of course we're finding out that people do need more assistance in trying to get down a certain degree of threshold weight, and then increasing, basically they get an improvement of the insulin sensitivity, and then they can start managing a lot of these other diseases, because the metabolic syndrome includes not only effects on the heart, but because of the effects of the heart, because of diabetes, the hypertension, hyperlipidemia, and just this overall what obesity does as far as inflammation. I don't feel good, and you're also hungry all the time. So it's a bad cycle, and it just feeds, if you will, feeds on itself. How to reverse disease and get back toward health. That's what we try to do here in cardiac rehab. Over and over again, it starts out with changing our nutrition. I know down in cardiac rehab we do a lot of getting people active, but really and truly, the first thing is cut out the crap, the calorie-rich and processed foods. I mean, 70% of the foods being eaten in the United States right now are ultra-processed foods, and so only 30% of people eating food. And we got to get back to mostly plant-based foods, and really reduce meat, dairy, cheese, and of course back with the calorie-rich and processed, it's our fast foods and processed foods. We got to move it. We got to get moving, and so in cardiac rehab, we're coming up with ways, walking more, lifting light weights, stretching, more balance, resistant exercises to really try to increase and improve our muscle efficiency. So there, as we found with the BIA use, there is this health and muscle that we've been identifying, and there's this disease and fat, and trying to flip that so that we get more muscle and less fat over time is helpful. But let's talk about the invisible. I mean, the invisible is this was a good quote I found from our author H. Jackson Brown. But sometimes the heart sees what is invisible to the eyes. We feel the emotions of others. We have these friendships, love, loyalty, faithfulness. All these things are felt. That connection between people, and so there is this emotional, invisible heart that is our motivation. It defines our purpose. There are fears, there are goals, there are feedbacks that make you feel good from positive feedback. There's successes, celebrations, and it really is our why. Why are we doing this? Why are we here? So we talk about the soul as one of those invisible things where each of us, talk about the soul being that spiritual or immaterial part of the body, and in general it's regarded as immortal. It is our purpose. It is our emotion and our intellectual energy that within us. Rick Warren wrote this Purpose-Driven Life. It's a good book, and something to trying to define that. What is our purpose, and why are we here, and why do we do what we do? I always like starting the day as best possible so that I'm almost putting on proper glasses to see the day, and the first thing I try to say is thank you. I mean, I think the attitude of gratitude will carry me further through the day than anything else, and also that I'm not doing this for me, but I'm doing this for someone else. I'm doing this for others. And I think once you start getting in that attitude, you're feeding the soul. It is that it works. So how do we know how to treat the visible heart, but how do we treat the invisible? It's so let's talk about certain ways that, you know, mental illness. I mean, which is out there, all the different things that spin off from all the stresses of the world, and sometimes even inherited and born with. But the you know, mental health issues have been problems because we just don't have access. People don't have access. It costs. They're not always covered. They're not often aware of how to go and get help. And there's this stigma. You know, if I have this, whether label, you know, what is that going to mean? You know, so this, and I think little by little that some of those stigmas, some of the awareness, all those issues are starting to head the right direction, but we still don't do a good job in this nation in treating mental illness. And I think there's efforts always to improve, but we're a long way from doing this well. Depression scales, they do matter for health. If you improve your depression scale in cardiac rehab, it's associated with improved outcomes. If you have an abnormal depression scale, or it worsens anyway, you have a worse outcome. I mean, it's been shown. These are, you know, morbidity and mortality. Loneliness. This was interesting. This was a thing that came out worse. Obviously, different issues related to the internet and COVID, but our Surgeon General just recently declared it a national crisis of loneliness, and that trying to address it and the consequences, you know, of it. What about constant stress? Well, we actually have found that it affects our adrenal gland. We actually will finally, the adrenal gland will quit trying. It's like, I've done everything I can, and it is a condition called adrenal fatigue, and it is just overwhelming stress that some people live under. How do we begin to help it? Even adrenal fatigue can be addressed with some lifestyle changes. First, eating better. I mean, it's amazing. Ultra-processed foods are associated with higher levels of anxiety, depression, and just feel bad. You just don't feel good. You know, eating more from the ground, the whole food plant-based approach is improvement. Anywhere you add, you know, the things from the ground, you actually are improving your mental health. It's been shown that then people are more willing to begin being more active, to do more exercise. I mean, when you just don't feel good, you don't even want to go for a walk. You know, and sleep can start if somebody has worries and concerns, and I mean, sleep is so important. Once you finally feel good after a good night's rest, you know, you're ready to, you know, take off and do the day again. Every now and then I'll get worn out, and I'll have people ask me, they'll say, well, you know, say, how you doing? And I say, and my usual back to them is I'm not having any issue that a day off won't cure. And if I'm at that level, that's good. Now, if I need a whole week off or a month off, it's going to be that's a bigger problem. But usually a good day off and recovering and refreshing, I'm good to go again. Cardiac rehab has clearly been shown to treat both physical and mental health. The CDC stated that cardiac rehab reduces the risk of death within 5 years of a heart attack by 35%. But also the mental conditions that are looked at, when we look at depression and anxiety scales, they're also reduced. And this is actually, you know, it's more than just the physical. that we're treating when people are people involved, people who have cardiac conditions may have these feelings of anxiety, depression, especially after bypass or a heart attack intervention. What does all this mean? And so when they get involved and they start seeing that other people are doing this, they're coping with it, they're doing well, it really does pick up. If I need to improve my depression scales, I can come down here, and usually a trip down to cardiac rehab will get me laughing, because guys like Will over here, taking over for Jeff. Oh my gosh. Oh my goodness. What? How are we gonna deal with that? Jeff will be back one day a week. That's he promises us. So, but it's that type of thing that you not only get to know what and why you're doing it, but you really do start feeling better about it. And is that physical? Is that emotional? Actually, it's probably both, and it's very important. Faith. It's interesting that religious involvement or spirituality has been associated with better health outcomes, greater longevity, coping skills, health-related, quality of life issues, less anxiety, less depression, and obviously suicide rates down. These studies, clearly, say that faith is important for healing from illness, and even helpful to those that may not even recover from their illnesses. So is religious good for mental health? Yeah, I think a lot of longitudinal studies really do show this. But is this any different than meditation? And we'll talk about that. But I think that people find or do what allows them to pause, to really think about things a little bit, and actually even allow time to even sort out. Sometimes people are just doing, not thinking enough. And hopefully this better satisfaction with the things people are doing and defining the purpose, very helpful in adolescents and teenagers. In Book of Common Prayer for myself in evening prayer, there's this quote, we have left undone those things that we ought not to have done, and we've done those things which we ought not. I read it wrong. We've left undone those things that we ought to have done, and we have done those things where we ought not to have done. And apart from your grace, there is no health in us. And this was a daily collect that I took a picture of recently and just wrote here. Almighty God, we have no power in ourselves to help ourselves. Keep us outwardly in our bodies and inwardly in our souls, that we may be defended from all adversities that may happen to the body, and from all evil thoughts that may assault and hurt the soul. So once again, just we're both this physical and this invisible. And in Christianity, we're taught that the heart is where God resides. That we're to write our rules and laws on our heart. And clearly, if we're to treat our body as a temple for this resident, don't you want to treat it pretty well? If you have a guest in your own house, you tend to treat sometimes better than what sometimes people are treating their physical body. Prayer, is it a form of mindfulness? Is it just being present and aware? Is it thinking about others? Is it being thankful? Is it asking for help for yourself and others? Just pausing and thinking through those things that might help people. So prayer and healing actually go together. So even, prayer of your own physical state and helping you with that, and even recovery, I think very important. there was a study actually of physicians praying with their patients and outcomes. It was interesting. A friend of mine in Atlanta at St. Joe's Hospital, they had a randomized treatment thing with prayer before bypass. So the surgeon would either pause and pray with the patients before they went in for bypass, or he did do it. And it was amazing, the outcomes were clearly on the prayer side. So I was thinking, well, which one did that help, the surgeon or the patient? You know, but I think that pause and that understanding that even what are we doing, what are we here for, and what is our outcome, and we pause and we pray for better outcomes. But it was a randomized study. It was fascinating to see. You know, I think in our bodies we talk about being holistic approach. Sometimes that's real fluffy, but it's this physical and spiritual, body and soul, and actually holistic and holy from the same derivation. So it's you know, it's because we should be more holy in different ways. You know, for what does it profit a man to gain the whole world and forfeit his soul? I always like that quote, and just a reminder that we need to take care of our souls, and yeah, that people trying to gain the whole world, you have seen them lose their souls, you know, in the process. Collective is church, family. You know, we gather together, we eat together, we support each other, and hopefully we pause at least once a week to do this. Blue zones, the one in the United States where people lived regularly to being 100 years old. You know, I had the most number of people at Loma Linda, and it was a group of Seventh-day Adventists out in California. So, but they eat mostly plant-based nutrition. In general, they don't smoke. They're trying to take care of their bodies. Interesting. Their goals is to be able to present a whole and healthy body to the Lord's table in heaven. I mean, so it's their preparation for heaven to do this on earth, so it presents itself healthier at that point. That's their belief. But they walk a lot more. The majority are not overweight. It's interesting, and they're the healthiest lifestyle that we define as this blue zone in the United States. So they're the one blue zone identified. There's other things. I had a patient today, and I was seeing her for irregularity of her heartbeat, but she would comment, you know, clearly she was worried, or, you know, had more irregularity of the heartbeat. If she ate anything, she'd get more irregularity of the heartbeat. There was this, even hearing her, there's this gut, heart, brain, and they're somehow all connected. They're not all, we still don't know all the connections, but we're definitely, our brain and our thoughts, you know, will affect the health of our heart, even the health of our gut. You know, is some of that the communication from those 4 trillion bacteria, you know, in the gut biome? We talk more and more about that, but it's 4 to 5 pounds of bacteria you're carrying around in your stomach that as you feed it right, you know, let it work for you instead of feeding it wrong. And that we've talked about TMA, absorption of a protein, that it gets oxidized and then affects other organs in the body. But there it is, this gut, heart, brain axis. It's really fascinating how it's not all connected electrically. You know, is it hormonal? Is it other ways? Is it something the bacteria is doing? I mean, it's fascinating. So we still don't know all the ways our body works for us or against us, but I can tell you that you feed that bacteria better. broken heart syndrome, Takotsubo cardiomyopathy, real fascinating things. There were people would have sudden heart attacks, and in the setting of bad news, there was a nurse in the ER. She got this phone call about mother had been arrested for shoplifting, and the next thing you know, she's clutching her chest in the ER right back at me, and the next thing we know, she's on the way to the cath lab. Get to the cath lab, take pictures, normal arteries, absolutely normal arteries, and this Takotsubo syndrome is a condition that comes on suddenly, and it can be in a physical pneumonia, urinary tract infection. It can be in the emotional stress, but in general, it's a sudden onset of something exactly like a heart attack. And in fact, sometimes the EKG is very much that, but it just, there's nothing wrong with the vessels. The flow through the vessels are fine. And this is what it does to the heart. The pumping function will suddenly get stunned. People will go into heart failure, from it. They can't breathe. And the EKG is really abnormal. The troponin level's abnormal, and within a day of treatment, it'll go back to being normal. It will go. So, it doesn't. The abnormality of the pumping function doesn't follow a blood vessel distribution. It seems to be the way it got its name. The Takotsubo was from this squid net. It's a type of Japanese squid neck. So it has this narrow and then widened out base as it dragged along and collected the squid. And somebody saw that, I guess from Japan, said, that looks like a squid neck.
There's a new video, I think it's finally uploaded to the TMH website. It's a story of a lady with Takotsubo from the last hurricane.
Okay. And then basically, how do we treat it? Well, we typically treat it like congestive heart failure. We get fluid off. We get them on beta blockers. We'll get them on ACE inhibitor or Entresto or ARB. But some people have it over and over again. I've got one lady that's had it 4 times, and it's like, oh my goodness. And those individuals, you really start trying to get at how they deal with stress. And so that takes a bit of counseling, a bit of coaching, and maybe even this what's called cognitive behavioral therapy, which is a different way of thinking about things. In other words, you can have, if stimulus A creates stressor A, well, we may not want there if we keep getting Takotsubo from it. So let's figure out a different way of thinking, addressing, and that's what cognitive behavioral therapy really does. Bit of meditation and prayer, the more of a calming, the ways of de-stressing, the ways of basically quiet time, because sometimes we're just constantly, stimulated and on the go, and that may not be the way our bodies do need recovery. My personality type is more of an introvert. I'm not natural doing this. I'm not natural seeing patients. I have to go home and recover. And my recovery time is, I've found through my physical activity, swimming, but something that is, I get a lot out of that swimming and recovery. But I need it, and I need my rest, and I need my time off. So that's why using my day off is usually good. Psychological influences, our attitude. That if we start the day with an attitude of gratitude or an attitude of like, oh my gosh, this is awful, I'll never get through this. I'm not good, just irritable. That irritability that basically someone can barely poke them. They jump and they're fly off the handle and things. Hans Selye, wrote this back in the 60s, 70s, but it was he had his theory was that we develop that our resistance to different stresses can actually lead us to exhaustion, and this is a little bit that adrenal fatigue that does happen, and in those weakened resistances, we're more susceptible to the inflammatory conditions, chronic fatigue, shorter lifespan, a bunch of things. And he talked about stress and eustress and distress, because stress can be good or bad. I mean, yeah, I mean, good stress is I'm getting up out of bed, I'm getting to work on time, I'm trying to, I'm doing that. That's a you need motivators. You need distress is just feeling like you're losing all the time, and you're just going deeper and deeper into a hole that you just won't get out of. And those sometimes people need to turn to people for help. Personality types. There were two cardiologists, Dr. Marvin Friedman and Ray Rosenman, and they described personality types, this type A and type B personality. How did they figure it out? Well, they recognized there was this group of people in patients. They couldn't figure out this upholster and kept saying, your patients really wear down your armrest. They just wear them down. They're just scratched, and they're rubbed. The leather gets rubbed out, and he started realizing, he's got a different group of patients. So the type A's, they're in some ways they're successful people. They're self-driven. They're highly competitive, ambitious, goal-oriented. But they also impatient. Intolerant, aggressive, hostile. They're controlling. They have to have it their way. These people have the higher rates of heart disease and worse outcomes from it. They're the workaholics. They don't leave work. They're always in a sense of urgency. But once again they get motivated by certain challenges, and so there's this good and bad. The B types, these are the Dr. Earl McKenzie's of the world. They're the ones that a war can be going on, and it's like water on a duck. I mean, it's just they don't get moved by it. It's going to be that easygoing, relaxed, flexible attitude. They're imaginative, creative. They're lighthearted. They've got a higher sense of life satisfaction. They're fun-loving. They're easier to be around because they're just not flying off the handle. They're friendly, self-confident, reflective. These are that's the type I like to be. I know we all get pushed, pressed, and we're a bit of both. But I think if we could somehow get our personality types leaning more type B, we'll live longer. Number one. Cognitive behavior. I mentioned this before. It is interesting how it's your pattern of thinking. You have to sort of learn to recognize that some of your thoughts are a little bit distorted. They're really not that bad. You've got to think a little bit different. It's not trying to be, kind of getting out of being real, but in the light of reality, there's probably a better way to respond to this, or a better way to think about this, and this takes coaching and counseling. People that have developed some really abnormal thoughts need the really professional help. But the coaching and counseling can lead to more coping skills, and I think this develops more of a sense of self-confidence for us, in our own abilities. Meditation, what is meditation? I mean, this is a definition I saw written. It isn't about becoming a different person, a new person, or even a better person. It's about training in awareness and getting a healthy sense a perspective. We're not trying to turn off all thoughts and feelings, but you're learning to observe them and say, yeah, they're there, but you're not being judgmental about it. And that's back to that type B personality, I think, too. Mindfulness, how is it? Well, it's a type of meditation in which you focus on being intensely aware of what you're sensing and feeling in the moment, without interruption or judgment, and just kind of, saying, yes, that's there. And you work on breathing better, imagery, that has been added with it, and these practices can help us relax and basically help our minds recover from the stress, and just overall reduce the effect of stress on our thoughts and our energy. So in conclusion, the heart is both visible and invisible, and basically complete health is treatment of both. Stress is there. It will always be present. There will be troubles. It is our attitude toward this stress that affects our health. And then participation in cardiac rehab has both physical and mental improvements that lead toward better outcomes.